Welcome to today's video. In this lesson, we'll explore Marfan syndrome, a genetic connective tissue disorder that affects multiple organ systems, including the skeleton, eyes, heart, and blood vessels. By the end of this video, you'll understand its definition, epidemiology, clinical characteristics, genetic cause, diagnostic criteria, treatment, prognosis, and the role of genetic counseling. Marfan syndrome is an autosomal dominant connective tissue disorder caused by mutations in the FBN1 gene, which encodes fibrillin-1, an essential protein for the formation of elastic fibers in connective tissue. Because connective tissue provides structure and support throughout the body, Marfan syndrome has systemic effects, primarily involving the skeletal system, cardiovascular system, eyes, and skin. Marfan syndrome is considered a rare disease with an estimated prevalence of 1 in 5,000 to 10,000 individuals worldwide. It affects both sexes equally and occurs in all ethnic groups. Around 75% of cases are inherited from an affected parent, while approximately 25% result from de novo mutations, meaning the mutation appears for the first time in the family. The underlying cause of Marfan syndrome is a mutation in the FBN1 gene located on chromosome 15q211. This gene encodes fibrillin-1, a glycoprotein essential for the formation of microfibrils, which provide strength and elasticity to connective tissues. Mutations in FBN1 lead to defective or insufficient fibrillin-1 haploinsufficiency/negative dominance, resulting in weak connective tissue, increased activation of transforming growth factor beta, TGF-beta signaling, and progressive tissue degeneration, particularly in the aorta and skeletal system. More than 3,000 different mutations in FBN1 have been described, most commonly missense or nonsense variants that impair microfibril assembly. Marfan syndrome affects multiple systems. Let's break them down by organ system. Skeletal system: tall stature, long limbs, and long, slender fingers, a feature known as arachnodactyly. Arm span greater than height. Pectus excavatum sunken chest, or pectus carinatum protruding chest. Scoliosis, or kyphosis. Joint hypermobility and flat feet. High-arched palate and dental crowding. Cardiovascular system: the most serious complications are cardiovascular. Aortic root dilation and aneurysm formation are common, which can lead to aortic dissection, the most life-threatening manifestation. Mitral valve prolapse and aortic regurgitation are also frequent findings. Ocular system: ectopia lentis, dislocation of the lens, typically upward and outward. Myopia, increased risk of retinal detachment, glaucoma, and early cataracts. Pulmonary and skin: spontaneous pneumothorax, theatolungula, skin striae. Nervous system: dural ectasia, or widening of the dural sac around the spinal cord causing lower back pain or neurological symptoms. Diagnosis is based on a combination of clinical findings, family history, and genetic testing. Because Marfan syndrome affects many systems, diagnoses can be challenging, so standardized criteria are used. The Ghent criteria. The Ghent nosology integrates clinical signs and genetic testing to confirm the diagnosis. The major diagnostic features include aortic root aneurysm or dissection, measured by Z-score. Ectopia lentis. FBN1 pathogenic mutation known to cause Marfan syndrome. Systemic score is greater than or equal to 7 based on skeletal and other physical findings in individuals without a family history. Diagnosis requires aortic root dilation, dissection plus ectopia lentis, or an FBN1 mutation, or a systemic score is greater than or equal to 7. Or ectopia lentis plus FBN1 mutation. If there is a positive family history, only one it's needed. Ectopia lentis, systemic score is greater than or equal to 7. Aortic root dilation. Genetic testing for FBN1 mutations provides strong support for diagnosis and helps guide family screening. Scoring of systemic features in the revised Ghent nosology. Wrist and thumb sign, or wrist or thumb sign. Pectus carinatum, or pectus excavatum, or chest asymmetry. Hindfoot deformity, or flat feet. Pneumothorax. Dural ectasia. Acetabular protrusion. Reduced upper-lower segment ratio and increased arm height in no severe scoliosis. Scoliosis or thoracolumbar kyphosis. Reduced elbow extension. Facial features. Dolichocephaly with inophthalmos, down-slanting palpebral fissures. Malar hypoplasia, retrognathia, or microdathia, high-arched palate and dental crowding. Skin striae. Myopia, greater than 3 diopters. Mitral valve prolapse. Conditions that can mimic Marfan syndrome include Ehlers-Danlos syndrome, which also features hypermobility and skin findings. Loeys-Dietz syndrome, another connective tissue disorder with arterial aneurysms but distinct facial features. Homocystinuria, which can also cause lens dislocation but typically downward, and is accompanied by intellectual disability and thrombosis. There is no cure, but treatment focuses on preventing complications and improving quality of life. Cardiovascular management. Beta blockers like propranolols or angiotensin receptor blockers, such as losartan, help slow aortic root dilation. Regular echocardiographic monitoring of the aorta. Surgical repair of the aortic root if it reaches critical size, typically 5.0 centimeters or earlier in certain situations. Ophthalmologic management. Regular eye exams for lens dislocation, glaucoma, and retinal problems. Orthopedic management. Bracing or surgery for scoliosis or chest deformities if severe. Lifestyle recommendations. Avoid high-impact or isometric sports. Genetic counseling and screening of family members. With early diagnoses, medical therapy, and proper surveillance, life expectancy for people with Marfan syndrome has improved dramatically. Today, most patients can live near normal lifespans, provided cardiovascular complications are managed appropriately. Marfan syndrome follows an autosomal dominant inheritance pattern, meaning that each child of an affected parent has a 50% chance of inheriting the mutation. Genetic counseling is essential for understanding recurrence risk, guiding family testing, discussing reproductive options, including prenatal or pre-implantation genetic testing. Early detection in at-risk relatives allows monitoring and intervention before complications develop. Marfan syndrome is a prime example of how a single gene defect can impact multiple systems, yet with proper diagnoses, surveillance, and management, patients can live long and healthy lives. If you found this video helpful, don't forget to like, subscribe, and share it with others studying genetics or medicine.